And Dr. Darien is back with a health and wellness question from one of you. Katie M is asking, what puts me at a greater risk of developing a pulmonary embolism, and what can I do for prevention? And Dr. Darien, let's first things, what is a pulmonary embolism?
I'm happy you asked, because I feel like I'm always repeating myself with these diagnoses. This is something really commonly we see in the emergency room. A pulmonary embolism is when a blood clot forms, most commonly in the legs. That blood clot then travels or embolizes to the lungs, and that can lead to an obstruction of blood flow, an obstruction of oxygen, symptoms of shortness of breathing, strain on your heart, and it needs to be treated often with anticoagulants or blood thinners.
So who's at greater risk of developing this, and can we also talk prevention?
Yeah, so there are some red flags when I'm listening to a patient talk about their risk. For example, if a patient has had recent travel that's longer than 5 hours, if a patient is pregnant, if a patient is using hormone therapy, if they smoke, these are all risk factors that can increase your risk of developing a blood clot. So how do we prevent that? Number one, you want to prevent it by physical activity. Physical activity improves blood flow, that improves circulation, and that decreases the risk of a blood clot forming. Also, compression stockings. Having compression stockings that go hopefully up to your knee, you can wear them often when you're traveling. That again can decrease swelling. Also, raising your legs up at the end of the day can again reduce swelling, reducing your risk. And then most importantly, asking your doctor if you're in need of anticoagulants or blood thinners. Certain conditions like heart arrhythmias, certain surgeries, they need anticoagulants to reduce their risk of a blood clot. So it's important to talk to your doctor about it.
So important. Thank you very much. We appreciate it. And folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions at ABCGMA.